It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger with Jim Knox. We're back again with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that help change people's lives.
That's right, Candace. Let's start off with our first best doctor, one of the top ear, nose, and throat doctors in the Houston area. It's Dr. C.T. Nguyen.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really, without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
Kimberly was born premature, so we had quite a bit of time in the hospital, about 6 weeks after birth. And it was about 2 weeks into that there was some discoloration to her left cheek and her lower lip. And that later started to grow, and we found that it was hemangioma.
Kimberly was born with a congenital hemangioma, which is a blood vessel tumor. It involved the skin of her face, and it also involved deep structures as well.
Coming to Dr. Eisemann and him explaining that it would be a process, but there would be a time that we really wouldn't be able to look at her and know the starting point with regards to the growth.
We basically like to tell them in advance what we're planning on doing, and in her case, it's a staged procedure, and it was planned just that way. If you're trying to do too much at one time, it can even be dangerous as far as the bleeding is concerned. So we tell them in the beginning that we're doing as much as we can at that time, and we probably removed maybe 20 to 30% of it, probably the first operation, and she's had 5 or 6 operations since.
I was excited because after all of this, I actually look like this. At first it was a lot, like all around my face, But it was, now that I look back at it, I'm actually really excited or happy.
There have been times that she came in after surgery that from the point of entry, we would hear, Kimberly's here, Kimberly's here, Kimberly's here. And people would come out, you know, and just, hi Kimberly, how are you, Kimberly? And that means so much, and especially for an 8 or 9 year old who's bandaged from surgery, you know, it just goes without saying that his office staff is so supportive and so caring.
It makes me feel nice that he cares, or that he has, like, that he is nice enough to ask me how am I doing, or how is life going for me now.
Well, it's changed her life, you know. I can't imagine her going on life the way she was before without having had surgery. I don't think she can either.
I would say that people don't stare at me or talk about me or anything like that. They treat me nicely, and now I just feel really excited or happy to see that I can do all these things confidently because of Dr. Eisemann.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
Charlie's weight was 380 pounds with a body mass index of 58. So, I mean, he's clearly in the high-risk group. In fact, anyone with a body mass index over 50 is considered super obese and has an even higher risk than our average patient would have for developing problems.
My wife and I did a lot of research when I decided to have weight loss surgery. And I chose the sleeve mostly lifestyle reasons.
Really what the operation is based on is changing the stomach into a narrower tube like the esophagus or the small bowel.
The recovery for my surgery, Dr. Marvin tells his patients up to 3 weeks to return to work. So I took the full 3 weeks off. I had the time to take. I probably could return to work after 5-7 days.
In modern society, we just don't need a stomach that we've been provided with. Whether it was evolutionarily necessary to be able to store a lot of material at one time because humans or pre-humans were not eating very often. But with the way our society is now, we simply don't need that much stomach. For some people, that becomes the pitfall. The capacity's there, and it generates the extra hunger that's just not necessary anymore.
You know, it is a complete lifestyle change. The day I came for my very first weigh-in, I weighed 429 pounds. Today I weigh 265.
These operations provide the best chance of curing diabetes there is. People with diabetes generally go and see an endocrinologist who will try to control the blood sugar with medications, but that doesn't make the disease go away. Having a gastric sleeve, or particularly a gastric bypass, the cure rates are high. A gastric bypass, the cure rates for diabetes are probably 80%, 85%, maybe higher than that.
For the sleeve surgery, they say the average patient can expect between 45 and 83% of their excess body weight to disappear, go away forever. I had surgery, day after tomorrow will be 6 months ago, and I've already lost 63.6% of my excess body weight. I sleep much better, I feel much better. You know, I mean, everything's just so much better.
Everyone should have a complete physical every year. There are 4 important parts to a complete physical. There's the history. Your doctor will ask you about diseases that run in your family and diseases and problems that you may have had, including surgeries that you've had in the past. Then there's the physical exam. The physician will look in your ears and your throat, listen to your heart, check your thyroid gland, push on your stomach, check your reflexes, and check for moles and other problems that are important to find at an early stage. Then there's the lab work. We do a lot of lab tests during a complete physical, and the reason for that is to pick up everything from cancer to cholesterol. And then the 4th part, and this is the important part, the physician will tell you what is particularly important to you to stay healthy, based on your own history and physical and lab work, as well as just in general for the population. For example, should you be on vitamins? How much exercise should you get? What should your weight be? So stay healthy. Give yourself the gift of a complete physical.
The ideal patients for dental implants are ones that have been through lots of restorative procedures, and where these procedures that just aren't predictable. And so we were able to give them their third set of teeth with the use of dental implants.
I had an accident when I was 10 years old, and I fell down on my face and I dislocated my jaw. And I didn't know that then, but I started looking for the oldest doctor or the one with 35 years or more of experience. So I went to the facility on Gessner and I saw Dr. Metz, and they said, this is the guy who's gonna have to be working on you. I had to decide if I wanted to go through with it, and I did research. He graduated top in the class.
So in Tico, we were able to move his upper jaw forward and set his lower jaw back so as to help line up his skeleton so that his teeth meshed together well. We, as specialists in oral surgery, are uniquely qualified to provide these procedures.
I just figured out this is the best facility, this is the best doctor, and I truly believe that, you know, Dr. Metz and his team, they know what they're doing.
These patients, when they come down the hallway, when we see them after this procedure, we see their level of confidence has gone up tremendously. We can tell by the smile on their face as well as their dress. They're dressed sharply and they're holding their chin up. You can certainly tell that they are happier individuals afterwards. Technology today has, really revolutionized how we practice implant dentistry. We have cone beam CTs, which allow us to take a CT of the patient in the office, and in about 20 seconds, we have 360 degrees of bone around the implant. So we know ahead of time whether we need to graft and also the type of grafting that we need to do ahead of time. So patients are better prepared for the experience and know more what to expect afterwards. We're able to do this in a safer fashion. And it's much more rapid. The procedures are much more rapid, and the recovery is much easier as well.
Jill came to see me for hearing loss. And then while she was here, she told me she had some allergy problems, and then also the snoring, and it was feeling like she had insomnia, and she couldn't stay asleep during the night. She was tired during the day, wake up with a dry mouth.
I think you have sleep apnea. I'm going, what's sleep apnea? He said, well, sleep apnea is where you don't get any REM sleep and you don't sleep well. Are you tired a lot? I said, I've always been tired.
We obtained the sleep study and found out that she had, a lot of sleep fragmentation from snoring and from sleep apnea.
He said, well, we'd like to do the second test, of course. We diagnosed the fact that you do have a sleep apnea. So went in another night, electrodes, but I had a mask this time. And I fell asleep. I woke up the next morning. It was like, wow! I mean, geez, it was like, I am so rested. So he didn't have to do a hard sell or anything with me. I mean, he said, you need a BiPAP machine. We've decided that, and this is why, and he sat down and explained everything to me.
If you have the other effective treatment option, and you decide to have surgery, and there's something that I think that we're gonna do that has a good chance of making you better, then let's do it. But for some people, it's just not their best interest, and she's happy. Jill sleeps every night, has no complaints, she loves it, it's safe, it's effective, guaranteed to work. Are we gonna beat that with a surgery? No, we're not.
My coworkers at the time noticed an immediate difference between, I didn't tell them what was going on, but they noticed an immediate difference in my demeanor and my approachability.
If that therapy makes you feel great, I just think that your opinion of that therapy is gonna change. Right? Now, if you can't use it, you're claustrophobic, you have an obvious anatomic problem, and sure, let's go down this other path and we'll make you better. But better and perfect aren't the same,
It's made a great impact. It's really, the only thing I miss, and this is gonna sound crazy, but I'm used to having 22 hours in the day, as opposed to 16 or 17, and I can't get as much done as I used to get done because I'm sleeping. But the trade-off is great.
Don't forget, for more information on any of the outstanding doctors you see on today's program, head to the website, bestdocsnetwork.com.
That's right. Now it's time to meet our next best doctor, plastic surgeon, Dr. Greg Bancroft.
When you talk about Ceci, she's talking about issues that pretty much any lady who has had several children will talk about, that they just feel that their stomach never quite went back to the way it was before.
I've been active all my life, and in sports throughout high school, my collegiate years, ran track and field and competed in Miss Fitness USA competitions and had a flat stomach for pretty much most of my life. I had 3 beautiful girls, but with the pregnancies, I had 3 C-sections also. And so having the flat stomach before and not able to achieve that afterward was kind of like, a punch in the stomach, so to speak. And I wanted to do something about it.
And you can do all the exercise in the world, you can diet all you want, and you will still find ladies that still say, I just bulge a little bit more than I remember. And why do they? It's because that tissue, that connective tissue there of the stomach, has basically been kind of stretched out like a balloon that's been overinflated, a rubber band that's been pulled too far, and it never will snap back to the way it was before.
I need to start, doing for me now, just getting my body back to the way I wanted it to be. And I really didn't think of plastic surgery, but I did my research and I'm glad I did. I'm just so happy that I did.
You see all the effort you're putting in, you want to see the results, and that's frustrating for any individual to do something and not see the results from it, and that's where she was. But then after the surgery, once you get that tightness back and fix the tissues that were stretched out by pregnancy, then it just adds that whole measure back to her exercise that she wanted to have from before.
The flat stomach, it is there. We've gone on 2 cruises already, and I've been in my bikini. I haven't been able to do that in a long time, since before my competition. So that was back in 1999. So I hadn't been able to do that in a while. I'm full force working out, doing ab exercises, working out with my husband, and running, jogging, just doing all the things that I used to do, but now I can show it off and I can wear a half tank top, to work out in. It's like things I didn't think I would be able to do again. Thanks to Dr. Bancroft, yeah.
My name is Rashid Rashid. I have an MD and a PhD. I was born and raised in Puerto Rico, went on to medical school at Loyola University. I did a combined degree program. I did an MD and a PhD at the same time. So it took me 7 years. Normally, if I had done them separately, it would have been a 10-year program. I've always had a very strong interest in research. I really like to understand where the information we use comes from, why we use the information we use, and why things are happening. I trained at MD Anderson, so when I did my training there, I had the opportunity to do rotations in clinics around the country, including at UCSF and other clinics that specialize in hair loss. So it always fascinated me to be in this area where few people were in, and where it really matters to people. It really matters to people that they're losing their hair. And yeah, we have over almost 70 peer-reviewed papers, all in journals that have very strict criteria for publications, including national journals like academy journals and our specialties in dermatology and medicine, trauma, across the board. Our hair loss papers mostly focused on things like other peripheral associations with hair loss, like vitamin D deficiency. We have a paper that is often cited about vitamin D deficiency in hair loss. We do a regular daily auditing of the peer-reviewed research, and we regularly review and examine what's out there. We consolidate that, we provide that in an updated blog we have online, and it basically summarizes all the main new research ideas that are coming into place or they're just being developed by scientists and physicians around the world. So our method is called the follicular unit extraction. That's been around for a few years. It used to be done manually, hair by hair. It would take a long time. Now we have different devices and machines that have sped up the process, so we can do larger cases in less time, and the price is also more acceptable to people than it used to be. You would get more hairs, get back to work, and a lot less downtime. And the healing is very, very quick.
Dr. Meredith Morgan is one of the best physicians in helping women manage menopause. Practicing for over 35 years, Dr. Morgan, as you see, has a unique office. It's located in the Museum District, a freestanding facility with a relaxed atmosphere. Today's topic, perimenopause.
It's really important to understand that this is a normal process, and it happens with all women. It starts in their mid-40s. The average age of onset is 47, and on average it lasts about 4 years.
According to Dr. Morgan, perimenopause represents a change. Women will experience a number of symptoms.
This is a time of relative estrogen deficiency and brings on mind, mood, memory, and even sleep disorders and irregularities. Yes, there are hot flashes and night sweats that most women think of as menopausal, and yes, they can be just as severe as the postmenopausal ones. But the differentiation between transitioning and a non-cycling constant state is the unpredictability and uncertainty that can be so distressing to a woman.
For women experiencing perimenopause, Dr. Morgan outlines the next step.
We have 3 levels of management. The first will be basically lifestyle adjustments and home remedies. The second is non-hormonal medical prescriptions, and the third is hormonal management. We want to treat at the lowest dose for the shortest duration, consistent with what the need is. We have to understand it's important to use what is acceptable to the woman herself. In my mind, without a doubt, we've taken a step forward for the city of Houston and its surrounding environments. We've developed a site that is comfortable and convenient, that provides medical center quality with minimizing the hassle that's involved. It's been very rewarding to have done this for the last 10 years, and I'm looking forward to the next 10 and 20 years in continuing to do and help women throughout the entire region.
Officer Wayne Schultz weighed an unhealthy 554 pounds until he met Dr. Robert Marvin. To find out more on Wayne's story and other life-changing stories, log on to bestdocsnetwork.com.
I think there's a lot of confusion now about exactly what an allergist is, because a lot of people do allergy testing that are not board certified in allergy and immunology. So what we see actually in this practice is not always allergy, but people come to us because they think that it might be allergy. Well, little Garrett Mueller, that has been a patient of mine for quite a few years, has multiple food allergies, and this has really been his biggest problem in life, is learning how to eat properly and not be different from the other kids. His mother brought him to us early on, and we were able to diagnose some of his food allergies, and he's outgrown a few, but he still has some that are very dangerous for him.
Because allergies run in our family, and things like asthma and things as well, we came and had him tested at the age of 1. And at that point, we found out that he was allergic to all dairy products and also peanuts. So it changed how I had to shop and how we did things in our home. I would label foods that said, "No, Garrett," and label things that said, "Okay, Garrett." We had a Garrett shelf.
Actually, Garrett brought this to one of his office visits, and I was so amazed by it. This is Garrett's story of his life with food allergies and how it affected him, and he fully illustrated this book himself. And it's pretty amazing from the time he was first diagnosed and how it affected his life. This is a very verbal young man who knows what he needs to avoid and what he needs to do. So we're hoping that maybe one day he'll be able to be a little ambassador in the world for his food allergies.
She talks with Garrett. She asks him questions as well as asking me, and she really listens, and that helps us to be able to manage his allergies and his asthma. If you want a doctor who will take time with you, who will get to know you and work with you on your own preferences with the medicines and things like that, that Dr. Dickens is the person to see.
I saw the potential in 3D at really taking digital to where we needed it to be, and it really has become what I would call a revolution. And I was very strong in my recommendations to the company that we really focus on looking at this as a screening tool. That's where it was going to make its impact.
2 years ago, I went for my annual mammogram and was in there, and they told me that they were doing a study for the 3D, and they asked me if I'd like to participate, and I said sure. I was already back there and undressed, and it was not a big deal.
She was the second patient in the multi-center trial that we did in 2010, and you had to come and get your standard 2D digital mammogram, which got read separately, interpreted by a different radiologist, and then the 3D exam would be performed separately.
First, I got the letter that said that no problem, didn't see anything, come back next year. Then I got the phone call and they said, well, no, we saw something in the 3D. And it turned out that one of the tumors was actually an aggressive, the HER2 had a HER2 marker in it, which is the more aggressive, can be one of the more aggressive cancers.
As we're able to page through the breast a millimeter at a time, we're able to look at areas that we would struggle with before on the 2D mammogram and say, is that something or not something? If you find malignancies less than 10 millimeters in size, the prognosis for the patient is essentially the same as the general population. So most of those people, the vast majority of those people, 98%, are cured.
Obviously somebody up there was looking out for me. I mean, I think it's the greatest thing. I mean, I think it saved my life.
So this woman had received a normal letter for her regular digital mammogram, but on 3D, we were able to find 2 very tiny cancers. That's the value of finding it at this stage, and that's what makes this test the most exciting thing I've seen in my professional career.
Here at Revella Plastic Surgery, we perform plastic and reconstructive surgery. We emphasize aesthetic procedures, primarily of the breast, body, and face.
I was predisposed to like a droopy jawline, and so that began to be my focus when I looked at myself in the mirror.
Cheryl came to me with the concerns about her, again, the jowling area and deep lines on her face. She's a yoga instructor, and in particular the Bikram type of yoga where it's very hot, and I think she perspires a lot and is very thin, and she noticed her skin sagging. So to help her with that, we did what we call a mini facelift.
I talked to the staff first and then had a consultation with Dr. Revella, and he recommended doing a mini lift. I felt like I was ready to do that, and just with some guidance and the questions that I asked and the way they were answered, I felt like it was a comfortable procedure for me to move forward with.
In general, most of the patients are women that come for a facelift. They're in their early to mid-50s. They have the signs of some jowls and what we call marionette lines. Those are lines that go down on each corner of the mouth. They have some wrinkled skin on their neck, and so that would be probably the ideal patient.
I'm only 3 weeks out of my surgery. I feel like, I'm really happy with the results.
Well, it's a good feeling to know that she now feels more confident, and she's of course smiling and very happy with the results, so of course I feel good about it.
I feel like that with the advice and the treatment and the service that I get at Revella Plastic Surgery, I'm able to really maintain a level of confidence that allows me to get in front of people, and most of the time with no makeup on, and I feel really good about myself.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that have helped change people's lives. For more information for any of the fine doctors that you've seen on today's show, head to our website, bestdocsnetwork.com.
That's the place to go. Also, if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com. That's info@bestdocsnetwork.com. So long, everyone. We'll see you next week.